joining me to discuss this further is a social commentator, Innocent Adulugba. Now, to speak on measures that we have been taking, to deal with this. But first, on one hand, we see that we're not able to detect the virus on arrival. But on the other hand, we also see the swift response by the Lagos State government and the Federal Ministry of Health. What does that say about our level of preparedness?
Thanks for having me on the show. With the evidence and the issues you have presented, we should be scared. We should be afraid. It has moved from a pandemic that was endemic to an epidemic. It was endemic.
Or an epidemic.
Yes.
A pandemic.
Yeah, from endemic to epidemic. It's endemic when it's permanently in one location.
Absolutely, yes.
Now, epidemic-wise, it has arrived.
Okay.
Nigeria has a new unwelcome guest. And we fear for children who go to school and come back. And from the example you cited, coronavirus, with the magnitude it's ravaging, is not something you contain with actions or policies spontaneously. You can deal with it with a testament to the efficacy of your medical infrastructures on ground, your annual allocation to the health sector in the national budget, possibly in the last decade. And then, I dare go further to say, a minister, a governor, a senator, a president, have you ever heard they're about to become grandparents and one of their children went to give birth in a hospital in any town here in the country? All of this put together will tell you the feeling of the common masses about what stares us in the face.
Even with the swift response that we've seen in a couple of hours.
Well, it's commendable, but the country has just 4 health sites that can combat this, including the one from the NCDC, the one that research outfit there in Abuja. And if you take our population, the number of states, how many urban cities we have, 4 is also scary. We should be prepared, but we should be scared because we have seen with the aid of technology and news within the last couple of weeks how very high-tech countries are going about this, and the deaths have not stopped yet. And so coming home here from the Senate report, I think our screening and quarantine should start on arrival at the airport.
All right. I want to pick on something you said, because you said we should be scared, even though the Lagos State government and the Federal Ministry of Health has tried to assure Nigerians of their preparedness in the last couple of hours. But let's look at the fact that earlier, the Minister of Health, Osage Hanere, said that the country would not restrict air travel. What more do you think we should do to protect air passengers?
I think if you look at the news we have been reading, we should be worried and possibly halt that, as it were. A country like Saudi Arabia can call off a Hajj. There's the Vodacom Rugby World Cup, penned to hold a match, has already been postponed, has been called off. In Italy, where it is like the epicenter in Europe, very important matches, football matches, tomorrow and across the weekend have been called off. Or the matches will be played with no spectators. Imagine a big clash like Inter Milan versus Juventus is going to be played behind closed doors. The fans are shut out on health reasons. Udinese, Fiorentina are going to stay in empty stadium. The same with Parma and Spal, Milan, Genoa. And then you have Saudi calling off a Hajj, Mongolia president getting self-quarantine and halting flights, and you get these measures being taken. And like I said, comparatively, developmental-wise, these are countries ahead of us, trying to take preemptive measures from afar. So as a country in Nigeria, with our population, we shouldn't let it come too close and then develop spontaneous actions.
Let me ask you, because this is now a matter of national health security.
It is.
What areas do you think we should be focusing on now?
Well, if you look at the spread, it's viral, it's aerial as well. And those who have survived it is just a testament to their strong immune system, not possibly the vaccines being developed as it were now. And we are at an infant stage in vaccines production, locally speaking. So we should really focus, for me, screening, quarantine, the therapeutic side of it, hand washing. You know, I don't know how church gatherings will be across the weekend because it spreads quickest among a crowd of people, cough, pneumonia, and the like. So possibly, and then there should be sensitization campaigns ongoing. It may keep people alert.
All right. Good. Thank you very much, Innocent Adulugba, for your time.
Thank you very much.